as I mentioned, we've got various techniques that we can use, and we found our trigger points, we've located our trigger points, we feel comfortable that we are working on trigger points. We can use our thumbs, we can use our elbow, we can use the good old knobble. Now, my hands are getting a little bit baggy now from a few years of doing manual therapy, so I quite like the knobble. It's a nice little tool. I usually walk around, keep it in my pocket. It has a little pointy end, which is very good for the specific areas if you want to do like inhibition compression techniques. It has a latex band around it. Some of these are made of wood, so they don't come with a latex band. It's very good for sort of transverse movements over the tissues. And then we can also actually do some of the deep stroking massage with the flat head. And this device is actually very useful for the home regime, which we will be talking about a bit later on. If we've got our trigger points, you've decided they're in the rectus spinae or in the quadratus lumborum and you're going to address them, there are different techniques we can use. One is a deep stroking massage. You would locate the trigger point and you could either use the part of the knobble or your thumb, and I tend to use the larger head on the knobble and just rotate it around, getting stronger and stronger. If you want to be a little bit more specific, it's often easier just doing it with your thumbs or your knuckle. To start with, maybe that's what you will want to do, just so you can feel what you're doing. And the idea is that you will do a kind of rotating massage type movement, or even a transverse massage type movement. Quite useful technique. It's comfortable on your hands, it's comfortable for the patient, and gradually you feel the trigger point melting away. The more common technique is the inhibition compression technique. Termed by Travell and Simmons, because you get kind of blanching of the soft tissues when you remove the pressure. Usually that's the more common technique. It's the one that's more known for trigger point treatment. It lends itself better to the tools, especially if you're using the knobble or any of the other tools. One will basically find the trigger point, apply pressure and hold it there for 20 to 30 seconds. Sometimes you may do it longer to actually get this sort of referred pain coming on. I often don't feel I have to do that, but some people prefer to do that. And then, having felt the trigger point start to melt away, release, just give a little bit of massage, and then come in again and push in deeply and hold 20 or 30 seconds and release, and then again a little bit of massage and easing, and retake and reassess, because having done these techniques, if we've decided that we had some sort of restriction, we want to see if the restriction has gone. So the restricted movement, whether it be flexion or side flexion, we will do again and reassess that to get an idea if we're on the right spot or we're doing the right thing. So they're the basic techniques for trigger point release using our hands, or probably a little bit less invasive techniques. We're now going to go on and have a look at something a little bit more invasive, and that is dry needling. I mentioned the various techniques we can use using our thumbs, the knobble tool and some of the other tools that are available. They're useful, but sometimes we want to be able to get in a little bit deeper. Now, one of the most effective ways I found of treating trigger points, and I can say when I first learned to do trigger point therapy, or I first became a physiotherapist, I started using dry needling, and I found it to be really, really useful, to the point that I basically didn't use electrotherapy for years. But you have to have done a course to have done this, and this is just to give you an idea of how you can use another modality to sort of influence the input-output paradigm for low back pain. But to do this, this is not a course, this is not showing you, this is not teaching you to do dry needling anyway. There are other courses, a lot more in depth, and you need to do those, and you need to be working according to your licensing and your state qualifications regarding that. You don't just dry needle, because it can be quite invasive and problematic if you don't know what you're doing with it. Having said that, if you do dry needling courses, it can be very safe and very, very effective. If you imagine, if you've got a layer of muscles like the erector spinae and the quadratus, and you're not sure you're getting in, you can feel it. You want to get in a little bit deeper, or even a little bit more specific. And again, we're not talking about X marks the spot here. With trigger points, once upon a time in the tale, this is the trigger point here for quadratus lumborum, and here and here and here. I don't think you can really do that. On John Sharkey's book, he both on dry needling and trigger point treatment, he says, you know, he doesn't advocate that X marks the spot, because one muscle could easily have a number of trigger points. But if we found areas that we want to trigger point, dry needling can be quite useful. Having said that, the World Health Organization recommends the area has to be clean, not recommends, states that the area has to be clean. It doesn't have to be sterile. There's some argument about the body flora and things like that, but in today's sort of atmosphere, especially with corona and things like that, or COVID-19, it's better to just sort of sterilize the area. These little packs of alcohol pads are coming very, very useful. They cost next to nothing for each one, a couple of dollars for a box. And I just clean the area to make sure the whole area is sterile. So having cleaned and sterilized the area, and that's my personal preference. I would prefer to just go and sterilize the area rather than just washing it. And then I will put my gloves on, as you can see, and I will then take my needle. Now the needles are one-time use. We've not got an autoclave or anything like that. We take the needle out of its package. They're held in a little introducer type tube and a little sort of holder that stops it sliding around. And the needle is going to be able to move up and down the tube quite easily. I can actually take it out of the tube and slide it back in. I will locate the trigger point. Now, some people use a pen to mark it. I personally prefer not to do that, simply for the fact that if you stick a needle through a pen, there's a chance you tattooing somebody's back, and they're going to look like they've got some of these prison tattoos, and they're not going to thank you for it. There is an easier way of doing it. You may find that you've got the trigger point. Now I keep an introducer handy. I've just taken this one out of the packet, but I keep a spare introducer handy, and I just make a little mark on the back. And I'll say to the point I think I've got the trigger point, and I'll say to the patient, you're going to feel this pressing. And in actual fact, this pressure of the tube, the introducer, is actually harder and a lot. If it's uncomfortable, and it's not uncomfortable, is more uncomfortable than actually introducing a needle. I've just stuck the needle in there. The needle has gone in. I will then just take it into the point where I feel some sort of grasp on the needle. It's almost, you feel like the muscle is biting the needle. They will often feel a sort of a discomfort. They will say, oh, that's the point. There are different ways of doing this. Some people like pistoning it in and out. Some people like twisting it. What I do is I go into the point where I feel the needle grasp. I twist it a little bit, and then I just leave it, and I leave it for maybe up to 2 minutes. And then sometimes I come along and just a little bit more twisting, maybe just piston it again. I find that's a lot more comfortable than the pistoning in and out that some people do. That's not a problem. Everybody has their ways of working with it. Some people twist it around, some people do some along the meridians. That's just my preferred way. I find that quite useful. I then remove the needle. I place my finger on it, or if there's any bleeding, the alcohol pad, or a new alcohol pad. I then take the needle and I put it in a box. I have one of these little ones. They're quite useful to carry around, and then I put it into a bigger box, which I then dispose of. So that's just dry needling. It's only a taster. It's just to give you an idea that that exists. I might find different trigger points, and I will needle those different trigger points. Again, it's a matter of preference. Some people will use a single needle per trigger point. Some people will just reintroduce the needle into the the introducer and then move on to the next trigger point. It just depends on your preference and how you're going to be working with it. I often will just use a number of needles. I find patients are more comfortable with that. So that's dry needling. We're now going to move on and talk a little bit about cupping. Another technique that's really quite useful is cupping. There's argument about how this works, what it does. It could be a counter irritation. The fact that I'm actually placing something and moving the skin, moving the tissues around could be a method of counter irritation. Actually, so can hitting somebody with a house brick. I think they probably prefer the cupping. So that is one method, one reason the cupping may work. There's possibly an effect on lymphatic drainage, soft tissue movement, as I mentioned, similar to using kinesio tape, and activation of muscle spindles or effects on the trigger points, as we spoke about. So that's possible, some of the physiological effects of cupping. It's a nice little technique. You can do it dry, basically put the cup on the muscle. The cups sometimes just come with or without these sort of inside a magnetic sort of rod that can push into the trigger point. And basically one attaches the cup, 1 or 2 squeezes, and just leave it on there. It can be left for a couple of minutes. I don't want to mark the model, so I'm just going to remove it now. But we can leave that on. Don't be too concerned if you get these sort of petricity, which is where the blood is pulled to the surface. Some people say that's actually the release of toxins. I don't know how much evidence there is to support that. Another method of cupping, and it may be like you want to use it as an adjunct to your massage or your trigger point treatment. So for example, maybe you've come up to this patient and you've massaged their back. You've done the trigger point treatment either with a knob or with your thumbs. And at the time that you did the massage, you've put oil on the back. And so you've still got this oil there, having done a nice bit of massage and released the area. And then one will put the cup on it. Again, 1 or 2 squeezes. And because the oil's there, one can slide the cup along whilst maintaining the vacuum, and is a little bit more aggressive, a little bit deeper when we're moving the cup along, and it has some effect. And you can see there's still quite a lot of vacuum there. Although I've put some oil on, it's moved the tissue quite nicely. How does that feel? Good. She's nodding her head, so it's got to be quite good. And we can come over to the other side, and again, just, it's a little bit deeper than the normal massage that we may be doing, and possibly a little less thummy or pressurized than the trigger point release. And actually, having done this, I can actually feel quite a difference in the tension of the musculature of the model. So that's some of the techniques that we can use actually for muscle treatment, whether it be restriction. Obviously, give is a different thing entirely. If we've got give because lack of muscle, then it's going to be more exercise and to stabilize the muscular tissue. But if we've got some sort of restriction because muscle tissue is too tight, because of trigger points, because of increased tone, so we can use massage, we can use trigger point release using deep stroking, massage, inhibition compression technique, cupping, and even dry needling if we're qualified to do so.